Hello everyone, welcome to the video series by Swalife Biotech. Today we will be talking about what is virtual screening. It will be an AI-driven, network-based approaches for modern drug discovery. Virtual screening has emerged as one of the most powerful enablers of modern drug discovery. What began as computational shortcut has now evolved into a core scientific strategy that shapes how discovery programs are designed, optimized, and accelerated. In today's landscape, where artificial intelligence, network biology, and natural product research are converging, virtual screening acts as a critical bridge between chemical space and biological relevance. In this session, we will explore what virtual screening truly means and why it has become indispensable today, and how it integrates seamlessly with AI driven drug discovery, network pharmacology, and natural product based pipelines. Drug discovery is undergoing a profound shift. We are moving from traditional single target approaches towards a system level understanding of biology. Instead of focusing on one protein at a time, we now recognize that diseases arise from complex interactions across entire biological networks involving multiple targets and pathways. At the same time, artificial intelligence and data driven decision making have become central to discovery. Machine learning algorithms and large scale data analytics now allow us to analyze biological, chemical, and clinical data sets at a depth and scale that was never possible before. There is also a renewed focus on polypharmacology. Natural products and biologically evolved compounds are gaining attention because they often act through multiple therapeutic mechanisms rather than single isolated effects. All these shifts dramatically increase chemical and biological complexity. To navigate this complexity efficiently and intelligently, advanced computational tools are no longer optional, they are essential. Virtual screening represents a computational filtering strategy designed to manage this complexity. It evaluates large chemical libraries entirely in silico, predicting how compounds may interact with biological targets before any experimental validation begins. This early prediction steps serves as a critical decision layer in drug discovery, dramatically reducing time, cost, and experimental burden during early stage research. By analyzing molecular properties, predicting binding affinities, structural compatibility, and interaction patterns, virtual screening transforms vast and unmanageable chemical space into focused, prioritized hit lists. These hit lists provide a rational starting point for experimental testing, ensuring that laboratory resources are directed toward the most promising candidates. Now, why is virtual screening critical today? The importance of virtual screening has grown alongside the exponential expansion of chemical and biological data. Modern drug discovery now generates data at a scale that experimental testing alone cannot keep up with. Virtual screening enables rapid hypothesis testing by allowing thousands of compounds to be evaluated against multiple targets in a matter of days rather than months. It enables cost effective prioritization by filtering out low probability candidates early, reducing expensive wet lab experiments by as much as 70 to 90%. And most importantly, virtual screening allows multi target exploration. Instead of evaluating compounds against single proteins, it enables assessment across entire biological networks and pathways, aligning discovery strategies with the true complexity of disease biology. Artificial intelligence significantly enhances every aspect of virtual screening. AI models learn from curated databases of known active and inactive compounds, capturing subtle chemical features associated with biological activity. They also learn from protein ligand interactions, patterns derived from crystallographic and structural biology databases. In addition, AI integrates bioactivity profiles generated from high throughput screening campaigns, further strengthening predictive accuracy. Machine learning improves prediction by identifying complex, non obvious structure activity relationships. It enables intelligent ranking and scoring, producing more reliable prioritization of compounds. As a result, virtual screening evolves from simple computational filtering to predictive intelligence, anticipating compound behavior before synthesis testing or biological evaluation. Network pharmacology reflects the reality that most diseases are driven by interconnected biological systems. Virtual screening within this framework allows compounds to be screened against entire target networks rather than isolated proteins. This enables identification of multi-target ligands capable of modulating multiple disease-relevant proteins simultaneously. Such an approach supports rational design of polypharmacological therapies that act at the pathway level rather than the single target level. For complex diseases such as cancer, neurodegenerative disorders, and metabolic conditions, virtual screening adapted for network pharmacology enables simultaneous evaluation of compound effects across their entire disease networks. This systems level screening identifies hits that modulate multiple nodes, increasing therapeutic efficacy while reducing resistance and failure. Talking about natural product discovery, natural products bring unique advantages to drug discovery. They exhibit exceptional structural diversity with complex chemical scaffolds that have evolved over millions of years, providing access to regions of chemical space rarely explored by synthetic libraries. They also demonstrate chemical bioactivity, often interacting with multiple targets in ways that translate into improved safety and efficacy in vivo. However, natural product discovery faces significant challenges due to the size and complexity of natural compound libraries. Virtual screening addresses these challenges by enabling computational navigation of hundreds of thousands of natural compounds. It predicts multi target interactions, efficiently prioritizes bioactive phytochemicals, and dramatically reduces the time from discovery to experimental validation, often by more than 60%. Now, types of virtual screening used. Two primary methods are used in virtual screening and they are often applied together. Structure based virtual screening relies on molecular docking simulations to predict how compounds bind to known protein structures. This approach is widely used for target specific hit identification, lead optimization, and structure activity relationship studies. It offers high precision when protein structures are available and is commonly integrated with AI assisted scoring to enhance accuracy. Ligand based virtual screening relies on similarity searching, pharmacophore modeling derived from known active compounds. It is especially effective when protein structures are unavailable and is particularly valuable for screening complex natural product libraries. Together, these complementary approaches maximize hit discovery while minimizing false positives. Modern drug discovery workflows integrate multiple computational and biological layers. AI guided prioritization analyzes libraries, compound libraries, and multi-parameter optimization to predict promising candidates. Virtual screening then evaluates target compound interaction across single or multiple target proteins. Network pharmacology mapping reveals pathway level effects, off target interactions, and mechanisms of action. Finally, experimental validation through in vitro and in vivo studies confirms computational predictions and establishes biological relevance in disease models. Virtual screening sits at the center of this integrated workflow, connecting artificial intelligence, systems biology, and experimental science. Virtual screening is a foundational enabler of modern drug discovery. It serves as an integration bridge, seamlessly connecting AI algorithms, network pharmacology, and natural product research into unified workflows. It supports system level strategies that are essential for addressing complex multifactorial diseases. Most importantly, it transforms early discovery from empirical trial and error into intelligent predictive and computational science. We view virtual screening as a core intelligence layer that enables smarter decisions, stronger pipelines, and more effective therapeutics. The future of drug discovery will be shaped by the integration of biology, computation, and systems level thinking, and virtual screening lies at the heart of their transformation. Thank you for your time and attention.